Welcome to the village.
Good morning. So Lori's still out today. Gabby's still on PTO. Don't send anything. I don't think Bonnie realized it yesterday, but I think Wendy caught what she sent to her. And Joan won't be here today. Anybody have anything good from yesterday? There has to be one good thing. One good thing from yesterday. Jaimie?
We have several good things in Pete's. We have our babies, newborn babies. Let's see. Just the kids in the day. You can come in a grumpy mood and then just see a baby smile. That's a good thing.
Yeah, we have a lot of newborns.
COVID. That's why there's a lot of newborns. Anything anybody has any concerns about? No? Okay. Cheryl, you have anything? No? All right. Zachary's will be stepping away. I already talked with Mel about it. Take your time and good luck.
Thank you. Yeah, good luck. Thank you.
And make sure you utilize one of those offices so it's kind of quiet for you. She's taking her TEAS test so she can go to LPN school.
Good. Good luck.
All right. That's all I got for today, right now. Dr. Majid is going to be we're going to go around for most of the day, and at lunch we'll try to grab some of you. Also at lunch, the pharmacy's coming over here. The phones will be rolled. We'll go in the conference room. The pharmacy will be in the lunchroom with subs. But this is so kind of to, if patients listen to it, to give them like our perspective of a day, what we do.
So I have one good thing. I had a patient that needed insurance information updated. Tried to reach him a couple times yesterday, and he reached out to us through the portal and expressed his love for the portal and how it is a fabulous tool. And he was able to upload his insurance information, and I was able to change it so that it's updated and it's correct, so he won't get a bill for being uninsured. And I messaged him back this morning and thanked him and asked him to please bring his card in because it does scan in small, but he was thrilled with the portal and had the easy access to us through that.
That's awesome.
So I'll give a background of myself a little bit before people start hearing more. I have been in healthcare since I was 16, 15. I did the CNA program at the BOCES in Johnstown when I was a junior in high school. My whole family's pretty much everybody is in the healthcare, or was. My grandfather is a pharmacist still. He's half retired, sort of.
Where does he work?
He has been at Palmer's in Johnstown for a very long time, and he did retire, but he still works when they need help. People have had babies, people go on vacation. He cannot sit still. My grandmother was a phlebotomist, then was very successful as a laboratory sales rep for their equipment. So I definitely have always been within that. I grew up in Krog Lake, so I kind of had anywhere like within a 20-mile radius of nursing homes to work at. So I did start at nursing homes as a CNA in St. Johnsville and Palatine. That wasn't for me. I knew that.
Mm-hmm. Why do you think it wasn't for you?
I like different things throughout the day. Mm-hmm. And it takes a very special person, I think, to really enjoy the nursing homes. Mm-hmm. And I feel like it's nice to get to know those patients, and you know them in and out because they have been there or are there usually a longer period of time. I like seeing different things every single day. Mm-hmm. So once I graduated nursing school, I did waitress and bartend for a little bit while I was going to school. I knew with a child, I really wanted to be Monday through Friday as well. Yeah. Then I started at a private practice once I graduated from nursing school, called Capital Care, and that was really a great foundation, and it really made me love primary care. The drive was not fun. Yeah. And I was going to go back to school full time, but it just wasn't the right time, so I ended up applying at St. Mary's and started at the Kanjahari office and quickly just took off. I became the lead there, and within 2 years, a year ago, there was the opportunity for this position as manager. Mm-hmm. And it's exciting to be in such a big office and in primary care. There's just literally, you never know what's going to happen.
Yeah, you never know what issue is going to arise.
It's not like the urgent care or the ER kind of crazy. It's just, you're always on your toes.
Yeah.
And especially as a manager, somebody always needs something.
Yeah.
There's never a dull moment, really.
And we're all right here in front of you, which is unique too. The office is big enough where we just have like one manager, and you have enough to do in this one office. Like some managers are in different sites.
Right.
But you're right here in front of us.
Yeah. Shannon, the one primary care manager, she is new into primary care. She now oversees the Gloversville and Northville office. Oh. She has been with St. Mary's for a very long time. She just new within primary care. Becky is the manager of Broad Alban. They're not fully St. Mary's yet. They're what we call a captive PC. So they're very self-sufficient. They kind of have like an office coordinator there. But she also oversees the Johnstown Primary and Johnstown Pediatrics, which we did talk about. I also oversee the COVID testing site right now. That is still open. It's right across. It made more sense for me to take care of that because I'm right here than Becky, who's in Johnstown, just trying to help out. And then we have Diana, who oversees the Canajoharie office. So it's busy, a lot of fun.
Well, it's been awesome having you as the manager. I think you really want to make change. You want everybody to kind of be content with what they have to do. And you're definitely
helps that I have worked alongside of the majority of people within the office, the nurses especially, and then even when the COVID site first opened with the pandemic, it was so much different than it is now. We had providers there, and it was crazy. Cars were lined up. Now it's much, much different.
They rejected me to work there. I think because I'm straight peds. And
Dr. Comer, well, he's pulmonology too. He was there.
Yeah.
Now they don't need a provider. It's a two-man show there. Do you need an appointment and a script? I've worked with the clerical staff here. They were in that site. Many of the providers here, I worked with Gabby when she was doing her rotations in Canajoharie with Dr. Comer. I did not work with you. I worked with Dr. Saha one time.
Oh, yeah, I didn't know you until you started here as the manager.
Yeah, and I did not go to Memorial, like the family, but I had worked with Denise, who was a nurse here previous, and Nancy, who was here previously, and then I helped out at Conductor a lot. So most people I did know or work alongside, and I, like I said, was in Canajoharie on the floor not that long ago. So I feel their struggles and see it and want to help them. So it's nice to have that both perspective side to be able to try to figure things out and help them as much as I can.
Like you had a lot of experience in a small amount of time.
Yeah.
Okay, so what was that we just heard? Everybody kind of gathered together.
So every day at 8 o'clock, we have morning huddle. We go over the staffing, if there's any changes, any call-outs, anything that we could have improved on from the day before, any positive things from either patients or staff, anything patients had said, any difficult things that we could encounter throughout the day, if anybody noticed those, or maybe a patient that needs a wheelchair so people can know ahead of time, any patients that are new patients, like newborns from other hospitals, we need those records, or any adult patients that had a previous primary not within St. Mary's. We want to have those records before they come to their visit. So that's just kind of stuff that we go over in the morning.
Nice. So it's like a good way for all of us to kind of communicate together.
Yeah, it's like a mini staff meeting first thing in the morning.
Especially this is important because we merged the 3 offices, right?
Right.
I don't know if the community realizes exactly what happened. The 3 primary care offices merged into one big office.
Right. So that happened in June of 21, and that was right before I came into this position. So there was Memorial Peds, Memorial Family, and then the Conductor, which was right across the street from the main campus. So they've been here a little over a year, and I worked alongside with many of the nurses and PRRs and providers that I now oversee. It has been a challenge, I think, for the staff because every office, although we're within St. Mary's, they have their little differences, and there's a lot of personalities that came with that, and that has definitely been a little bit of a struggle. The volumes were different. The phone call volume was much different in each individual office. Now it's just one office with the same, actually probably more patients. Trying to get back to everybody and see everybody is sometimes a little difficult.
We were talking to some of the nurses before too, how the phone volume has gone up. Besides our office, like there's been so many changes. You know, we always kind of think the community kind of thinks it's us or a lot of changes happen here, but I think it's kind of across the board. The healthcare system has been changing, and then the COVID pandemic just kind of turned a lot of things upside down. You know, understaffed and people kind of catching up on their needs. A lot of people didn't go to see their providers for a couple years, whether it was lack availability or not being able to come out of the house. So we're trying to get back into some things and make some things better. I think the big reason we want to talk to people today is have like a gateway between our office and the community to point out some of the changes and let them know that we see that there's been changes, see that there's been difficulty, and want to kind of communicate, because sometimes miscommunication, misunderstandings lead to frustrations all across the board, right?
Right. Since I've been overseeing this office, I do something different with the phones, which many people probably already noticed. You call in and there's some prompts for the different providers within the office, and then once you select what provider you see or your child sees, you can then select if you're calling for an appointment. Then you can select if you have something for the nurse, and then it will ring a few times, and if people are not patient facing, they are expected to pick up the phone, but there are very few times that people are not patient facing. The nurses are rooming patients, doing EKGs, giving shots, and then the PRRs or the clerical staff that check you in and check you out, they are trying to answer the phones, checking the people in, verifying insurances, sometimes having people signing records releases, coming in to drop off paperwork. And the ones that check out, they have the referrals to do, they have authorizations, scheduling appointments for other doctors that we have referred patients to. And that doesn't even really touch on a lot of things. They still have mail to go through, clerical wise. Nurses have paperwork for patients' disability, FMLA, school forms, especially summertime. That is a big thing for school age kids. And then the pharmacy will also sometimes fax scripts or send things electronically. So they're always busy. So if people are leaving a message, usually they can get back to them within a decent amount of time, if not by the end of the day. That is my expectation for all of them.
As you're saying this, you know, because earlier we had some of the other staff kind of express the same thing, that they're multitasking 3, sometimes 4 different things at once. It's good for me to hear that too, because in my day, I feel like I'm doing like 3 things at once at any given time too. But I just don't want the public or the community to feel like, you know, we're busy. Like,
right.
If they know we're busy, they're busy too. It's really just to impart some information to let them know that we're busy because we want to take care of them.
Right.
We're busy because we want to get things done as soon as possible for them. You know, we're all in healthcare. Like,
Right.
healthcare means taking care of people and their health and their needs. So just to point out that because it's so busy, in order for things to happen quickly and efficiently for them, like what are some methods that we've put into place to allow things to happen like efficiently? Yes, we want the nurses and the PRRs to get back to people by the end of the day. I mean, does that always happen? Is it sometimes the next
It doesn't
day?
always happen. There are certain cases where people don't need a call back within that day. Sometimes they're calling to schedule an appointment that's not urgent. If they're calling to schedule their physical, and that can probably wait until the next day as long as there's no issues going on. That's a routine visit for every patient. So stuff like that, it's not an urgent thing. If a patient's medication is a controlled medication that isn't ready to be filled, say it's about 3 days too soon, that is something that they can hold off on until like the next 2 days. But that's not even really something they need a call back for. We have the patient portal, which has helped in a few different areas. That is how people can get in touch with the providers, request refills, request appointments. Also, if people are unable to come into the office and need a visit, that's how we do our video visits, which is preferred for the providers over a telephone, just because you get to put your eyes on the patient and see what's going on. And that has decreased some phone volume. We have also kind of separated the office in pods, per se. There's pod A, which is the pediatric providers and family providers. With the exception of Gabby Spencer, she's in pod B, which is the adult providers and her. And then the nurses also are kind of separated through that. That is just for patient consistency and to have patients have more consistent areas to leave a message or know who they're going to be talking to when they do get a call back.
Yeah, I think that was one of the concerns that people started to say, well, now that it's the 3 offices merged, we never know who's going to pick up, who we're talking to. People do feel comforted by familiarity. We should be kind of like a family to them. You know, the community is like our family. And some people are actually related, but for the most part, we're all a part of a community here. So we just want them to feel as comfortable as possible. So I think splitting the pods that way was really good. Like in pediatrics, things are different than with adults. So people who know how the differences work is helpful too. You know, with all these kind of changes that have happened in society, I can't speak for all of healthcare, but we can talk about St. Mary's Primary Care. Is it the biggest office in primary care now?
Yes, it's the biggest office and has the most staff under one area. Besides Johnstown, they're pretty similar. They're just split up between Johnstown Primary and Johnstown Peds, but they are all still under one office.
So they're like in one office space?
Yeah, they're more separated than this office is. Their check-ins are also separated, where when you walk in here, they're all right there. So it's a little bit different and still technically 2 offices, but they do have pretty similar amount of providers.
Just to review, we want to tell the community, like, we want to help them understand the busyness, but we also want them to understand how they can navigate a little bit better. So we mentioned the portal, leaving a message. What about things like the script line and then med refills and paperwork? Like when people need those things, how can we get them done efficiently for them?
So if somebody drops off paperwork, it's not generally going to be able to be done that specific day. We ask that we have 48 to 72 hours to complete that paperwork. And if it's not been done before, we would like you to have an appointment with your provider so you guys can just go over that together. And that way we have it in case you do need it again. School forms, that should be done at any well child visit. Therefore, you will have it for when your child needs to go to school. Not all grades require it, but it is good to have it, and just in case, you never know. Things change all the time with the schools. I myself have a daughter, so I know all about the frequent changes. The scripts, we also ask 48 to 72 hours to get that to your pharmacy. A good thing to do is, if you notice you have about 5 pills left or a week's worth, give us a call. Just leave a very clear, right to the point message with your name, your date of birth, the name of the medication, and pharmacy. That way we can get it there a little bit quicker than if the nurses can't understand you or they don't have a name or a date of birth. Sometimes it's kind of like a little game trying to figure out who's calling or what medication. I know medications are definitely hard to pronounce a lot of times, even for us in healthcare. So when patients say things, sometimes it might not be exactly what is in the chart. Also, when people call multiple times and don't leave a message, that ends up getting frustrating for the patient, and then they end up getting angry. And when they do get in touch with somebody, we have encountered patients that have not been so nice. So definitely just, if you could leave the message, and just one message a day, and then follow up with your pharmacy. It is also preferred that if your medication is not a controlled medication, to call your pharmacy. We might be changing our script line to say that, so that they can request the medication for you and it'll go right to the provider. but that is a work in progress. So more to come on that. Controlled medications are the ones that you have to call once a month. That has to be looked up on a website by the nurse, then the provider has to sign off on it, and that cannot be sent. It's just laws. I mean, they're in place for a good reason.
Yeah.
But we can't send that to your pharmacy until generally that exact day, the 30-day mark, or if it falls on a Saturday, we can send it to your pharmacy on a Friday. But definitely when you notice you're down to, say, 2 days, give us a call. Or like I said, the portal, just shooting a message through there that you're ready for your refill. That will also decrease anybody's frustrations with phone systems. But we are working very diligently to try to figure out how to get the phone volume a little bit better. There's some different things within the organization as well that they are going to be trialing, not in this office right away, but we're hopeful that we're going to get somewheres and make it better, because that's ultimately what I want for the patients. I mean, I used to be on the floor at the Kanjahari office, and I've pretty much only worked in primary care since graduating nursing school. And I know providers, and the nurses and the clerical staff, we all just want to take care of the patients and do it in a timely manner. So we also want it to be as easy for them as possible. We're trying to help them as much as we can with our resources.
You know, we all are a patient somewhere.
Right.
So
we're still people.
Yeah, we're still people. We understand.
We get sick.
We get sick. We make phone calls. We get frustrated if we don't get a call back, So we understand how that can feel. So we definitely don't want to put our patients through that. Like, we do feel responsible for their well-being. And so just having them do things in a way that's going to help us to help them. So I think, to your point of, when you call once, leave a message, that call will be returned. If we do have people calling multiple times in a day, that is going to tie up the phone line for other people calling. If you don't leave a message, we never know you called. So call once, leave a message. If you don't hear back in the day or the 2 days, definitely call again. I think the portal is fabulous because you will get to clinical staff.
Right.
The portal message gets sent to the nurses, right?
It does right now. I do believe one other office so far has switched for the portal messages to go directly to the providers. That's also something I know I talked to you about it so far. I do think that would help, because I know sometimes the nurses are doing so many other things. It goes into what we call a workload. So sometimes those portal messages aren't getting looked at if you send it at 7 a.m. because you're trying to be timely, and then the nurses can't get to it until, say, 11, and then goes to the provider and there happened to be a sick child. We're hoping that if it goes directly to you guys, you might be able to get to the patient faster.
Yeah, see it, address it.
There are some cases where I believe the nurses were here to help the patients and our providers, so their responsibility is to gather as much information as possible before, but just with all the other workloads, I think if it's something that can go directly to the provider, it might help a little bit.
Yeah, we're constantly, I guess, we have a new office, we have a new computer system, and this is kind of like a new day. This is post-pandemic world is quite different than pre-pandemic, so we are working. We're always trying different ideas and trying to make things better. Like, I've noticed since I've been here, I'm going on my 9th year at St. Mary's, I've changed my scheduling grid, and the way I do things changes all the time, and because I'm working with what works best, most efficiently, so I can see as many kids in one day as possible. So how does this portal work? I know every time someone comes in, I mention the portal, and I tell them the girls out front will help you, but how do they help them? Like, there's setting it up, and then there's people have issues with their information. How do they go about that?
So there is an app. I am a St. Mary's patient in a different office. The app is very user-friendly. And if you come into the office and you tell the front-end staff you want to sign up for the portal, they can take your email address, then they can send you a link, and then I'll give you all the instructions. There is the web version, and that's what the link will bring you to get set up. But then once you have your username and password, you can download the app, and it's super easy, user-friendly. But you can change some information on the portal. You can, so for adult patients, we do, if you have Medicare, something called an annual wellness visit. And it is very beneficial for the patients and providers. It's not a physical, but it kind of touches base on any chronic conditions. But there's a lengthy questionnaire, and patients that are scheduled for one of those visits can actually answer the questions before they come here. That will be all set and in their chart when they get here for their visit. You can also submit, I believe I did my insurance card picture on there. You can update address. That's how you can pay bills without having to call the billing department if you do have a bill. I have done that. Just need the bill in front of you so you can have the number. And it's pretty streamlined. Don't have to talk to anybody.
On my day off, which is Wednesdays like today, I usually will sit down and like see if there's bills and stuff I have to pay. Yeah. And as many things I can do on apps as possible. Yeah. Because then real time, you can see that payment too.
Right.
So you can have that receipt. So you know that it was paid. I think if you have like a health savings account, you need to.
Sometimes, like I had to submit the itemized bill.
Yeah. You need to show that. Mm-hmm. And it's very specific and weird what they want. They're always like, no, that's not the right thing. We need this. And you're like, what do you need? Yeah. Like, I paid the bill, you know.
Nurses, and I am a nurse. First, and providers, and even some clerical staff, they're probably more proficient in it than we are, but insurances and billing, I have no idea. I'm learning more and more because that's just the role of a manager these days. Yeah. But and there's so many insurances, and so within each insurance, there's different plans. So things can get confusing, and definitely if you are signing up for insurance, ask as many questions to anybody that you can, because sometimes it can be confusing. And we've noticed that with some elderly, not even elderly. I know there's Fidelis, they call them metal plans. Mm-hmm. And some people didn't realize we don't really par with that. But we do have the St. Mary's Assistance Program. So we do have a patient who sees Gabby, and she was made aware when she wanted to stay with Gabby. So she has the St. Mary's Assistance Plan to assist with the bills for what isn't covered with that metal plan. Mm-hmm. The one downside was there was a case where she needed to go see another specialist within St. Mary's, but ended up having to go to Latour just because that would have been a much more expensive procedure for her than staying within St. Mary's. So it's just knowing or trying to ask the questions. Sometimes that does require calling the companies, but even kids, luckily there's the Fidelis regular Medicaid, and kids with vaccines. The state has the VFC program, which is very beneficial for a lot of families within our community. So just knowing what you're signing up for, that's a strong recommendation I have, because even we don't know a lot of times, because they also change the names. Blue Shield is not Blue Shield really anymore. I think it's called Highmark. So
see, I didn't even know that.
Yeah.
But whenever you have insurance or sign up for it initially, they do have a website. They usually will have like a chat or chat with an expert, or they have a lot of helplines, because I will give that to insurance companies. Despite all the complications they can create, they also have a lot of people like to help and answer questions. So they have all those different, like if you turn your insurance card around, they have like 5 different numbers, and there's always a customer service or a 24/7 helpline. So definitely trying to understand what insurance you're signing up for, and when you do sign up, the like nuances of it.
I would have never thought to check before signing up for something. You just learn so much more when you're working in healthcare. Yeah. I mean, I would just think every hospital participated with the majority or most insurances, but
not true anymore.
Not true at all.
I think the sad thing is that a lot of mental health places don't take a lot of insurance because they actually get paid less, or they get they just don't pay the mental health providers fairly. So that's the thing. Like, do we have like a navigator for insurances at St. Mary's they can talk to? I feel like they used to.
Yes. Well, I do have somebody. She's community outreach, and I believe we can give patients her name. We have to get consent. to have her call them, but then I believe she does try to help them get set up with insurances. That's kind of with the assistance program. There's just a form that the patients have to fill out and sign, and then it'll get sent on to the billing department. If anybody is looking to speak with somebody, if you come into the office, the girls up front know Gal's name and they have her business card. If they don't have any more up front, they know right where they are in my office. So they can help you with that, getting in touch with somebody within the community outreach.
That's great. I think that's the special thing about St. Mary's, right? Like we're a very old established facility that was created basically for a mission, and our role and our daily goal is the mission, is the care of our community. It's a very special community. We have a long, interesting history, and we're a really hardworking community of people, whether you're at St. Mary's or whether you're in one of the many other businesses around. Our goals are to care for everybody, whether they're poor, vulnerable, and really anybody with a healthcare need is somebody who is vulnerable in a way, and to be happy to be doing it, to advocate for our patients, and to be dedicated. I guess just a little history on St. Mary's, but we were actually founded by the Sisters of St. Joseph of Carondelet in 1903. So it's always been like we're a ministry of healing, and we want to treat everybody with dignity. And we really value, like, people and their lives, and human life is not something to be taken lightly. So we definitely want to continue. And we are a group like that. I know things can get busy, overwhelming, frustrating for everybody, especially when we're in a world that's been kind of struggling to stay afloat recently. In the past few years. But I think we're getting back to it. We have some new staff that are really just taking on the office by storm, and I think things are hopefully improving slowly but surely, and hopefully this show right here will help people kind of communicate a little more.
And we not only really value our patients and want to take care of them, but within the organization, we try to do a lot to boost up morale and give back positive reinforcement for people that go above and beyond. Any staff member can nominate somebody for what we call the VIP, and it's Values and Practice nomination. And that basically is something where somebody has, again, gone above and beyond for any of our values. Like Dr. Majid said, care for the poor and vulnerable, joyful service, integrity, advocacy, creativity. We've had a few people. Kristen Hitchcock, she is our wizard.
Yeah, gonna talk to her in a little bit.
She's been nominated because she has done so much and always goes above and beyond. If I'm not here and our director, Erica, she's not here, people run to Kristen because she can fix almost anything.
I can vouch for that.
And
and she's always here.
She's always here. It's very hard to convince her to take a day off.
Or to go home.
Although she did just get a puppy, so now it's a little easier, I think, for her to go home.
Okay,
it would be for me, too.
Yeah.
Then we also have, and actually I have had some of the nurses post these around the offices within the rooms as well. It's called the Daisy Award, and that is specific to nurses. If you want to nominate the nurse that has helped you either on the phone or in person, you just scan the QR code on that sign in the waiting room or in the room. It's on the doors when you go back out to the waiting room, and you can fill out the questionnaire right on your phone after you scan it, and then it gets submitted, and they get a little pin with a daisy on it and a nice award. The VIP nomination, you also get a $200 bonus. We've had a nurse, probably a few nurses in this office. A few months ago, our medical records custodian, Linda Russell, who can get records within like minutes for us.
Yeah.
She was nominated as well recently, or a few months back. So it is nice because sometimes we get so focused on, not that people are doing a bad job, but we want things to be so good. And we have nurses that, and clerical staff and providers that always go above and beyond. Unfortunately, the providers I don't think can be and myself cannot be nominated for the VIP award, but that's okay. I'd rather have them nominated anyways.
Yeah, I think, the positive, because it's the other staff that kind of gets the brunt of the negativity and the getting like slammed from all sides kind of thing.
Right.
So it is really good to remember the positive and positive reinforcement. I mean, the more positive feedback you get, the more positivity you want to do.
Right.
Positive attracts positive, right?
Yeah. And we also have the Smarties Committee, which I'm a part of. Erica, our director, a few of the other primary care managers, some clinical staff, our CCM nurse, Kim, she's on that. Inpatient nurses, HR people. And that is, again, to promote fun things across the whole organization. We do breakfasts for them. We meet every Friday. We'll have the cafeteria cook like breakfast pizza. And then us managers will try to take turns getting the stuff to the different offsites, because there's St. Johnsville Urgent Care, the Canajoharie office, which is near and dear to my heart.
Yeah.
Then we have Gloversville Urgent Care, Johnstown Peds, Northville. We have Broad Albin. So we take turns trying to get stuff like that. We do t-shirt and jeans. We just did Wear Red last Friday for Women's Go Red Day. We did Silly Sock Day. We just try to do fun things to boost the morale around.
Yeah.
I try to do that within the office as well. Around Halloween, I did a raffle basket. People could be entered. Their name was entered by kind of doing the same thing, going above and beyond. If I got a compliment on our surveys, if somebody pointed something out, if they picked up covering in another office, if somebody called out, all sorts of things. I want to do a pet board because everybody has pets usually. Yeah. So I think we're going to try to do that.
Do stuffies count?
Sure. Yeah. Or even a previous pet.
Oh.
So if you had one ever, you can have one of mine.
Oh, okay.
I'll give you a picture.
I want to pretend one of your horses is mine.
Okay.
That's important. I think the community appreciates to know that too, because you want to go to good atmosphere.
Right.
And we want to be happy to show up at work and, instill those family type values and have fun with it. I know we have our fun down at Peds.
Yes.
Where, kids feel more comfortable if it's more fun.
Right.
Can we just touch on the COVID site real quick a little, because you did mention it. So since we're on that topic, I think it gets a little confusing for the community about like what our site is for, when it's open, and what to do in order to get COVID tested.
Right. So our COVID site is open Monday through Friday from 7 to 3. Sometimes we do have to change those hours because, like I said, it's 2 people that run that and myself. There's a call out or staffing issues. We do shorten the hours generally from 7 to 11 just because we don't have that many appointments, and many appointments that are coming in are for pre-surgical. However, if somebody does need to be COVID tested, all that they need to do is call their primary care provider and let them know. Their primary care provider will just need to send a script over, unless they're within St. Mary's. They just have to order it because it'll be in the system, and then they just have to call to schedule their appointment, and generally they can get in either same day or next day depending. The results are about 2 to 3 days.
Okay, so they're not really for sick people anymore. Like if you're sick, what do you do?
Yeah, so if you're sick, they'll do the COVID test, but you just need the order. There's no provider there. It's just going to be a nurse coming out to swab. Then you'll get the results to the whatever provider had ordered it.
Okay, so basically you're not going to get an exam. It's really a way to get a COVID test, which I think a lot of people grab like COVID tests from the pharmacy now and stuff like that. So, and I see sick children is basically what I see all day. Even if they don't come in for being sick, they're probably sick, especially this time of year. But if I feel like I want to test them for COVID, or they want to be tested for COVID because they're sick with something, we do have...
We can do it here in office.
We have COVID swab, but we have a way to test them, so that's good.
Right. Yeah. A lot of the providers are, at least in my office here, we're back to seeing sick patients within the office. However, we do have some providers, like they are people just as much as everybody else. We do ask, depending on the provider, if you're sick, did you take a home test? We're not trying to be invasive. Mm-hmm. We just want everybody to be safe, because there's again, pediatrics in the waiting room, in this office. We want our staff and providers healthy so we can help our patients, because if a provider has something going on, they see a sick person and then they get sick, then their whole next day or whatnot has to be rescheduled, and it does get a little hard with that.
Yeah. You definitely want to keep as many providers here in the office as possible to take care of the community. And that's why we do have like video visits to our possibility. We might ask you to do one, or you might like to do one. So depending on how appropriate that is, at a given time, a video visit might be a good option.
Yep.